can regenerative therapies help with inflammation? Yes, for sure. Let's talk a little bit about inflammation though first and what we're really trying to do. When we look at inflammation, there's chronic, there's acute inflammation, and both of those, well, especially the acute inflammation, definitely has an important positive role in the healing, natural healing of both infection and injury. Now, when we get into trouble with inflammation is when it exists in the wrong balance and for too long. And this is where regenerative medicine can really shine, is to kind of reboot and reprogram that inflammation so that we're having the better type of inflammation, and also then so that the tissues can heal, so that the body no longer has to send signals of inflammation. The body will send signals of inflammation to areas of infection or areas of tissue damage because that's part of the healing process. So what we need to do is make sure that we evaluate the causes and why there's inflammation happening, and then use an appropriate treatment. Sometimes that can be stem cell therapy, like a Wharton's jelly or an exosome product, an amniotic fluid product. Sometimes that could be a PRP, and PRP plays a big role in modulating inflammation. Sometimes that could be peptides as well, used either alone or in combination with any of these other regenerative therapies. And then lastly, neural therapy using procaine is something that I have more recently learned about and incorporated into practice. With stem cell therapy, Wharton's jelly, amniotic fluid, or exosomes, those are they're not exactly interchangeable words, but those are all words that you're going to hear people talking about in the regenerative medicine space. And there's different benefits to each of those and different applications for using each of those. But when it comes to inflammation, using one of those types of products really can help dampen the harmful or tissue damaging type of inflammation, the more chronic inflammation as well, and really encourage the body to target its inflammatory efforts towards certain tissues so that they're healed and the body does not have to signal inflammation anymore. With PRP or platelet-rich plasma, one of the ways that that actually works is by creating a bit of inflammation. So the body goes, oh, I need to pay attention over here, better send the healing factors over here and heal whatever tissue that is, whether it's muscle or anything within the joint. So inflammation, again, is not always a bad thing. We just want to promote the right kind of inflammation for the right amount of time and then turn it off. With peptide therapy as well, we know even the most common peptides like BPC-157 and many others can have really profound and important inflammatory regulation effects. And so when we use those in combination with either PRP or stem cells or anything else, they can actually provide even more help in healing the tissues and then quelling the inflammation after. When I'm evaluating a patient for any kind of regenerative treatment, I'm always thinking about what is the environment into which I'm injecting, whether it's PRP, stem cells, Wharton's gel, whatever it is. If that patient's environment, their body, is not healthy or as healthy as it could be, those products are not going to be as effective. So oftentimes what I will do, even before I do any of the injections for regeneration, is we'll have a discussion about what are you eating, what are your blood sugars like, what are your inflammatory markers looking like, are you sleeping, are you exercising, so that we can basically ensure the best results possible. You know, it's an investment when you look at regenerative medicine therapies, and it's absolutely worth it. You also want to make sure that you're doing what you can from a patient perspective to make sure that you're going to get the most benefit out of these treatments. I often get asked if different regenerative therapies can be combined, and the answer is absolutely yes. And often they're synergistic. So certainly we could start out, for example, with an arthritic knee just with PRP and see how that goes. And very often that will be a great solution. The healing will happen and the patient will be fine and not need anything else. Sometimes, though, patients want a little bit more assurance or want to do more to assure good results. And so in that case, we can even add more of a Wharton's jelly product along with the PRP treatment, and we can do 2 or 3 injections instead of just one. So there's always flexibility in a patient's plan, flexibility and individualized decision in terms of what do I think is going to help that patient the most based on my prior experience, based on my training, based on my mentors and everybody that they've helped. So it really is an individualized treatment plan based on what's going to work and also what the patient can afford to pay. One of the reasons why I love regenerative medicine along with my functional medicine practice is because they marry so well together. Each of them works better with the other. And so it makes a lot of sense for me to be able to offer the regenerative therapy in addition to all the functional medicine treatments that we already do. So if you're ready to deal with your inflammation, your pain, your lack of ability to participate in life in the way that you want, I would be happy to have a discussion with you. We do free 15-minute discovery calls just as a courtesy to any patients who are new and just kind of wondering what we do and wondering if maybe we could be able to help them. So you can book online. You can book a discovery call with me online, or you can go to our website and check us out a little bit more. It's nourishhousecalls.com.